Hello, I'm Dr. Michael Higgins, hip and knee replacement specialist with Tidewater Orthopaedics. I'd like to talk to you today about a significant improvement in the world of orthopedics, the Ready knee replacement procedure. This is a muscle-sparing robotic knee replacement that's helping many patients suffering with knee arthritis. With the Ready knee procedure, no muscles are cut. Instead, the incision goes between the quads and the hamstrings, and the quads are moved out of the way. By preserving the muscles, there's a quicker recovery and also reduced postoperative pain. So there's less disruption of the soft tissues around the knee with the Ready knee replacement. With traditional knee replacement, the quadricep tendon and the quadricep muscle are split. This can lead to a lengthy recovery with increased pain and weakness after surgery. With the Ready knee procedure, the muscles are left intact, which allows for a faster recovery and less postoperative pain. Precision is the second key advantage of the Ready knee procedure. The robotic system that's used during this surgery gives me real-time three-dimensional imaging of the patient's anatomy. This allows for unparalleled precision in implant positioning and alignment. This precision leads to better fit of the implant for a patient's anatomy, improved range of motion, and decreased risk of complications such as implant loosening or malalignment. As a result of this precision, patients can anticipate optimal longevity of their implant and a more natural feel to their new knee. These benefits of muscle-sparing robotic knee replacement equate to a faster recovery for patients. Thanks to the minimally invasive nature of the surgery, most patients are able to go home the same day and begin physical therapy in earnest sooner. With quicker mobilization, patients are able to regain independence sooner and return to their active lifestyles faster. Patients just have a better experience with the Ready knee compared to traditional knee replacement. If you or a loved one are suffering from knee arthritis, make a consultation to learn more.